So we've tended to have not a pretty narrow base compared to some, and there'll be debates about expanding that to clothing. There'll be maybe exempting clothing under $100, or I mean, there's a variety of different ways you can do it. There'll be discussion about expanding it to services, but then which services? Are you willing to pay a sales tax on getting your car repaired? Is that fair? Should we do it on getting your hair cut? Advertising services within the newspapers, they tend to get a lot of attention. And it tends to not go very far because we all are dependent on the press to get our message out. And lawyers, if you're in tough trouble, do you really want to pay sales tax on it? Maybe you want the bad guys to do it, but how about an innocent person who's sued by the crazy guy down the block? I mean, it all gets kind of tricky. But even that doesn't raise that much money. Because it tends to have a depressive effect. Retailers have testified to us as to how much they have benefited by us not taxing sales. I've been told by retailers that they have to actually add staff on, and they pay attention to the game schedule whenever we play Wisconsin, because their people come in droves to the shopping centers and stock up on clothes. I mean, it's been an advantage for some of them up on near the Canadian border to have people crossing over from Canada to buy goods. And so, I mean, there's economic consequences to everything that we do. And so we're going to have to kind of weigh those sorts of things. And the picture that's going to we're always going to keep in mind is on the back of this, which is there's a lot of people unemployed. We're doing much better than the national average. Minneapolis is doing better than the state as a whole, but that is small comfort if you're a person who's unemployed and looking for a job. And there's just not enough opportunities for us to figure out how to create maintaining good jobs as well as growing new ones. And I always say maintaining good jobs because every person who loses their job, in general, the sad statistics are that when they're reemployed, it'll probably be at 10 to 20% less than what they previously earned. And many households have a really hard time absorbing 10 to 20% losses in income. And so you want to retain the jobs that we have, especially the ones that provide benefits. We have a lot more people who are not having health insurance. Businesses and employers are trying to balance out their budget. That's one of the areas that they're looking at. So they're shifting a lot more of the risk onto their employees with high deductible plans, less coverage, more co-pays, that sort of thing. And I've been working really hard to help our smallest businesses secure affordable health insurance. They are the mid-sized ones from 50 to 100 are really disadvantaged in the marketplace. We have enacted laws in Minnesota that limit the rate increases for businesses with 2 to 50 employees. They have guaranteed issue. Every insurance company in Minnesota must offer them a policy, and they must offer to renew it. So they can't drop you the minute you have someone with a bad back or diabetes or a child with a disability in one of the households that they're covering. But if once you hit 51 employees, you are in the Wild West. And I've been fighting the insurance companies all along on this and got into a work group this summer because this is one of the areas where they make the most profit because there is no regulation. And there's no guaranteed issue. They can drop people who are loss leaders. They can raise the rates up, 40%. They can just say, we're not going to offer you again. You're not a good risk. They can, and if you're larger than that, you're actually big enough to start spreading the risk and be a better risk to the insurance company. And they tend to, or you can self-insure and have some other products that are available to you. And so, if you're larger, you've got options. We've actually seen over the last about 15 years that there's been higher rates of insurance on the companies of over 100 employees. And there's been a slight growth in covering employees in the companies that have under 50 employees. But there's been a 9% drop of offering health insurance for those at 51 to 100. So that's where I've been really trying to target my efforts and trying to create options because those employers want to do right by their employees. But they're balancing out a really bad market. People aren't buying, people aren't doing things because of what's going on in the economy. They're trying to keep people on the payroll. And so I think we still got to figure out that one, and I know it's going to be challenging. I'm trying to find some people on the other side that will work with me on it, but they have different ideas.
Do you know the history of that? You know where that all came from?
We created it in law. I think we're the second state in the nation to protect small employers, and it was part of the Minnesota Care Bill that was passed in 1991. It started and then ultimately passed in 92. And Minnesota really did some major health reforms, which is part of why we have some of the highest quality care at the lowest cost, some of the lowest premiums compared to the rest of the nation. Because we did a number of different things. We created EMCHA. We were the first high-risk pool in the nation, so that if you have pre-existing conditions, you have diabetes, they can have a strong health issue in your health history, you are always guaranteed that you'll be able to have access to the marketplace in Minnesota as an individual. And it's protected our insurance companies, quite honestly, because someone applies for them and it's someone who's gotten a diagnosis of cancer or whatever the issue is. In the past, they would just they'd turn them down, and it would make, and then they'd have to go into government programs and totally impoverish themselves. Or where we created a high-risk pool, we assessed the insurance companies to pay into this. Unfortunately, there's some problems with that too. But and so if you have a health problem, you've used up your COBRA, you're unemployed, you can go apply for EMCHA, Minnesota Comprehensive Health Association. At most, their rates can be 125% of market. So if the average, rate for someone of your age and sex is $400 a month for a policy, then you might be paying $500. But if you've got a serious health issue, you're glad to step up with that extra $100 to cover the perhaps $1,000 or $2,000 a month of costs that you're confronting, whether it's in pharmacy care or other care. And so that has tended to stabilize our market. And part of the federal healthcare reform is to require all states to either set up their own high-risk pool or to be part of the federal high-risk pool. And so that's some of the things that we've done for decades that are now going to become nationally named policies that protect people. But
I have a question. You said there's some problems with that. So, would people be encouraged then just not to have health insurance until you get your cancer and then pay the 125%?
No, you never want to be in that. First of all, you want to be able to get preventative care so you catch things early and all those other sorts of things. But, yeah. No, actually, because we have had 93-94% coverage of insurance, we actually don't have. There's no evidence that we have very many people who play those kind of strategies. The people who tend to go without health insurance in Minnesota are overwhelmingly 18 to 24, 25. The young invincibles who think that they're healthy and they don't need it and they'd rather have a better car and a higher car payment than health insurance. And so when we look at who isn't insured, that's primarily who it is. It's the young people. And we solved that in part, and it's also been adopted in the federal reform by saying that you could stay under your parents' policy until you got access to health insurance through an employer, which covers a lot of college kids who are in internships and they aren't full-time students, so they didn't qualify for that protection. They might have caught mono and they no longer can handle a full caseload, and just when they need health care, they lose it. And so, or they're in that gap between graduating and getting that first job, and so that's been solved. The problem we have with EMCHA is that so many companies have decided to go self-insured, where they take on the risk rather than the insurance company. And when you go self-insured, by federal law, you're exempt from all state regulations, including the EMCHA assessment. And since 40% of the employers in Minnesota have gone self-insured, they're primarily large employers, the 3Ms and the General Mills, but also companies that have 150 employees, they don't pay into that pool. So for everyone else who's in the regular insurance market, it raises insurance costs because it's not on all insurance products, it's just those who aren't working for a self-insured large employer. And so that's why it hasn't proven to be as equal a funding mechanism, and we'd like to figure that one out.
Just the late out.
Who first?
That's okay. Sorry?
What committees are you going to be on this week?
I am on the property tax division, taxes in addition to the taxes committee, so we'll be in the midst of the revenue debate. And I'm on the Health and Human Services Policy Committee, which is another area that I've worked on. And then I'm on a fourth committee. Most people are only on three. And it's one that I hope never has to meet, and that's I've been asked to serve on the Ethics Committee. And the Ethics Committee only meets when one of our members has done something that another member thinks is serious enough that they should be sanctioned in some way by their peers. And so it's really like sitting on the jury in judgment of one of your fellow legislators and who someone believes has brought disrespect to the body. And I didn't ask for it, but I will serve if I need it. It's interesting with the Republicans taking charge of the House. They decided we would have less committees and we would serve on less. And it's another grand experiment. Last year I was on 5 committees. And I tend to like a broad and varied sort of set of assignments. So 3 feels a little small, but we'll see. It allows you to focus. It also means, though, that there'll be less cross-fertilization across committees. And so many issues impact each other. Oftentimes, I'm the only, well, I have traditionally only been the only person on the property tax division, for example, that serves on Health and Human Services. And so I bring the knowledge of what we're cutting in terms of the services that our counties provide in mental health and chemical dependency and corrections and other things into the debate about what's the trend line going to be in property taxes and what do we need to respond to. And so there's so many things that cross. You really do want some cross membership just so that things meet together well at the end. But I'm pleased with the committees that I have, and I think I can contribute to them. We do most of our work in committees, our most serious work, but then there's always lively floor debates. And you can watch us on TV. You can watch us on the computer at your own leisure. All of our hearings are either televised or you have audio files you can listen to on your computer. And I'm surprised always how many people do watch us. And that's good. And it's good to get the feedback of what it looks like when they see it on TV and what their takeaway is in terms of what worked well, what didn't in the debate. And then there's, of course, the Twitter world, which I haven't joined yet, but I might, that kind of gives people an instantaneous feed on some things that are happening as well. So there's lots of ways to keep track of this, and I'm just going to circulate these newsletters at this point, which has a survey asking for your input on both the budget and on how we might be able to help nurture the growth and sustenance of jobs. It also has how to contact me, and it has a response thing where you can check that you'd like my email update on what I'm doing and issues as I'm confronting them, as well as that session weekly, the free publication we talked about that can keep you informed in a free, skimmable, easy to digest way of what's happening in Minnesota.
Questions?
My blood boils when you talk about health care. I'm a Canadian, and so I've seen the other system, and I'm just astounded by what's going on down here. Had Senator Marty in to hear about single-payer health care, and a lot of your employment issues would be resolved if people could move around and start their own business without having to worry about, will I be covered if something happens? I started my own company in Vancouver, British Columbia. My totals for all at 45, 46 years old, my total insurance premiums for extended health care, medical, dental, semi-private, plus extended income continuance at $3,000 a month should something happen to me was $2,400 a year. And that covered everything. And I could go to the doctor without waiting lines. I had an MRI, my back went out, and I was in and had it done all in the space of a month, seeing a neurosurgeon for consulting, getting the results, having it all set up. So waiting, anyways, that gets, distracts. So my blood boils, so I'm going to get on my question because I could go on for longer than any of us have time.